Hi, my name is Grace Diana. I'm a healthcare provider, clinical officer by profession, and my current position in the hospital where I work is of a quality assurance officer. My role has been to ensure that documentation by the clinical team is up to standard and that we are not losing revenue unnecessarily due to poor documentation. So the QI project that I did was more like part of my work, and with time I was able to follow up and see the impact of training on the quality of documentation. So if I might just give a brief background, we were having very many rejections whereby say for example a doctor will perform a surgery that will require to be reimbursed by an insurance company. However, because of poor documentation, we'll find that, and specifically discharge summaries, you'll find that once that discharge summary goes to the insurances, especially NHIF, the procedure will not be approved. Reason being, the documentation was not well done. And so my role was to educate the teams concerning the importance of quality documentation on both hospital being reimbursed as well as patient care, so that patients will understand well the instructions that are given to them when they're supposed to return to the clinic, what instructions, for example, if it's a wound that needs to be cleaned. We went into the details of explaining all the components of the of a discharge summary, how it should look like as per international standards. So before even beginning the training process, my work was to do literature review and look at how does a quality discharge summary look like. After that, the next bit was ensuring that we summarize them in a way that is easily understandable by all, and then now presenting them in a simple form that is easy to understand. And we narrowed down to 5 components of a quality discharge summary. And so my work was just to inform the team on those components and why they were important. The 5 components, I'll share the components of the discharge summary in a separate document. And with the time, everyone started embracing the components that are needed to be in a discharge summary. And we also realize that for you to have a quality discharge summary, all the notes that you have written for the patient, they also need to have the meat. So overall, there was some improvement even in the clinical documentation, and we began seeing documentation having the meat, if I would say so, as compared to before, when the documentation of these summaries was very scanty. So this QI is just a project to show us that training as a tool has an impact when it comes to promoting quality in patients' care, in whatever aspect of quality we want to promote. In this case, we wanted to promote quality documentation for the sake of good patient care, as well as ensuring that the hospital doesn't lose revenue unnecessarily. And that ensures that the hospital is sustainable. And if the hospital is sustainable, we can be able to take care of more patients, even the ones who can't afford, because the patient can make an extra coin to take care of the least in the society. Yeah, so I'm excited about my QI to share the findings and what I found, and just saying that we can improve quality if we do trainings in a clear, consistent way. Found that healthcare providers are very open-minded. Whenever they are trained, they listen and they understand. But sometimes we don't have a good team that is training, or we do not know what we want to communicate. However, quality departments can be champions in training, because not everything that is supposed to be done in the healthcare industry is taught in the medical school or in the colleges, but quality departments are there to streamline, and we need quality training. So thank you very much, and thanks for the opportunity.